Hello guys, what's going on? Welcome to this second video. This is a second COVID update video. Actually, technically it's the third, but it's the third one where I actually have the computer screen working. Everything's visible. So today is January 29th, 2024. We're going off of trends from last week and trying to extrapolate them into the future. So today, COVID-19 transmission levels are 86% higher than they've been for the majority of the pandemic in the United States. So, wastewater level copies per milliliter are 836, 1.2 million cases a day, around 2.5% of the population is infectious. That's around 1 in 39 people. And from current infections, we're looking at around 61,000 to 243,000 potential long COVID cases from current infections today that can manifest in multiple different areas later on, whether it be in the brain, the lungs, the endocrine system, the immune system suppression, where people have weaker immune systems so they feel less damage from COVID specifically when they're sick, but other infections hammer them more, stuff like that. So that's still concerning, as we still are in high transmission levels. We're still higher than when we were during the summer peak, and we're still far off from the early summer low of around 200,000 cases a day, which is still pretty high, but it's not as high as it is now. So if we look at a 4-week forecast, where this is using Michael Hoger's model, and we extrapolate out to 4 weeks in the future. So we are still looking on the declining phase of this peak. This is the second highest peak of the pandemic. So we're looking at a decrease to 903,000 cases a day, which is a 26% decrease in the wastewater values. 2% of the population is infectious, and once again, 45,000 to 181,000 long COVID cases a day, which are long-term impacts like I just mentioned earlier. And then here's your table down here for number of people in your gathering or that you will be interacting with, like in a classroom, airport, restaurant, or just family members, etc. And then the overall chance that any given person will be infectious within that group. And as you go from 1 to 5, you're going to a 10% chance, roughly. And then to 9 people, you're going to 20%. 20 people, you're around 40%. And then it keeps going up from there to the point where if you're in a school building, a large restaurant, or if you're in any sort of public transportation system, the chance is nearly 100% that anyone's infectious with COVID-19 at the current moment. The dominant variant is JN1. There doesn't seem to be any new variants that have popped up, at least from any chronic illness cases of people, because the majority of COVID-19 variants come from people who have the disease chronically. And that's where most of the new variants, like Delta Alpha, stuff like that, came from those people who are immunocompromised, which the virus also immunocompromises people, so it's easier for it to make more variants in the future. Now, I won't read the full report here. I will try to show more of the report. Let's try to show the report. It's the 8th U.S. COVID wave. If we were to look at this line right here, this would be the first wave, the southern wave during summer 2020, the dark winter, and then this is Delta, Omicron, the summer wave of 2022. This is BA5, the CBB variants. This is EG5 and the CBB 1.16 variants, and this is JN1 over here. And then you guys can scroll down through this, look how the model is calibrated. And in some places, cases are higher. Others you have a rebound, you have flat cases. So it really depends where you are for exact numbers of what you're looking for, of how your personal risk will be going. Now for the USA, Canada, and UK, we have some sources here from other places, not directly affiliated with Michael, but we have in the US, like I just mentioned, have those stats. In Canada, around 7.7% of the population is infectious, 1 in 13 people. And then as you look down the list, group of 10 people, 55% chance that someone's infectious, 90% in a group of 30, and almost 100% chance for a group of 50. The UK data is a bit old, it's around 19 days older, So we can kind of discard this, but still very high transmission levels, around 2.3% of the population is infected. On as an average. This can change depending on where you are. Now, I do have this website, Iowa COVID-19 Tracker. This helps like put everything in perspective. Viral activity, at least from the Omicron wave. Everything just like reloaded. I gotta reload this, don't I? Alright, hold on. Alright, this should fix. Yeah, there we go. From Omicron to JN1 now. This is viral activity levels in the certain states. So the highest states right now, at least for COVID-19 levels, would be West Virginia, which is at astronomical levels. Minnesota and Virginia are at excessive levels. Alabama, Vermont, New Jersey, where I live, Utah, Missouri, and North Carolina, as well as Alaska, are in very high levels. And then South Dakota, New Hampshire, Delaware, all these states down here, if we were to be able to scroll through this, are in very high levels, and then it continues going down from there. And on a more local scale, you can go down here, get check viral activity per state via region. Get down here, look at raw samples of how much COVID-19 is coming out the wastewater. I should have to look through how these things are calibrated. But you can look through certain states, counties. We have Varelli transmission records as well, which is from wastewater scan. The average amount of COVID-19 that's in wastewater, the baseline is steadily increasing. So as you can see in 2020 and 21, there were defined periods where transmission was low. But as we're getting to 2022 and beyond here, you can see that there's no longer much green here. The baseline is pretty high. Now, the extremes might not be as high, but the overall lowest baseline continues to go up as time goes on, while the peaks tend to be around the same. So the amount of COVID-19 that's in transmission as the years have gone by keeps going higher and higher during the low times of the year. Now the good thing is, like mentioned before, in almost every state except for states like Rhode Island, for example, based on the data that we have here, the growth likelihood of the epidemic of COVID-19 is decreasing in the majority of states. In some states, it's stable, or it may be slightly increasing. We also have stats for the flu, which is also decreasing in many areas. But in places like California, Arizona, Oklahoma, Texas, and Vermont, and Indiana, and some other states, it's still increasing. And California is likely growing. So we'd have to keep an eye on that. And then down here is for Iowa specifically. And then these are down there. My computer just loaded. But those are U.S. historical case data up to May 11th, 2023, when the national emergency for COVID-19 ended. So these are all the stats from when data was first being collected up until May 11th. And everything afterward is basically we have to use wastewater to calculate everything. Now I do have a COVID-19 resources for Canada as well. We have the Canadian COVID-19 Hazard Index. So new this week, they have about 1 in 13 people is currently infected. And COVID forecast scores in most regions are similar to the maximum previous peaks of excess mortality for the epidemic to date in Canada. 20% severe in Canada, so which would mean 20% excess mortality above what will be normal. So that translates to about 1,000 premature deaths due to COVID-19 alone. Now, they have a lot of sources here, a lot of different things here. I haven't looked through every single one of these. They have one that talks about estimated Omicron daily activity limiting long COVID cases. So long COVID cases from Omicron that limit a person's ability to do activities throughout the day. So more severe long COVID where it impairs a person's ability to work. Like, for example, the 4 million people out of work in the United States due to long COVID because they cannot work physically in the office because they aren't able to do it, for example. So they have a lot of stuff here. I'll go through two of these. We have their graph, their forecast. Almost every single province is severe. V3 didn't load for some reason. But I think this is Alberta. This is British Columbia. I don't know where this is. Newfoundland, Ontario, Quebec, Saskatchewan, the northern provinces. And then if you scroll back through here, you can see the severe rating, the ratings going all the way back. And this is also based on mortality, infection rates, and it's also based on the impact of the healthcare system. Now, they do mention here that they changed the way they calculated the forecast because hospitalizations and death reporting for COVID-19 has changed since 2022. So they've revised how they calculate stuff, as hospitalizations and ICU admissions are lower, are reported lower than what they actually are. I believe somewhere in mid-2022 that number declined by half randomly, but if we were still counting as if we were before, then it would be higher. So just keep that in mind, for that's how they adjusted the numbers to bring this forecast. I'll have all these links in the description for you guys when you guys want to check them out. And this is the average weekly severe COVID-19 severe outcomes in Canada by year. And then we have 2020 through 2023. Population infected prevalence. Population vaccinated per recommendations. And as time has gone on, more vaccines have become available for different variants. So effectively, those who have been vaccinated for the original strains wouldn't necessarily be counted as vaccinated now, simply because that the virus has changed enough to render original vaccines very, very less effective compared to newer boosters, especially for CBV variants. And then now we have JN1, so we're still waiting on vaccines for those. You guys can see the numbers up here. COVID-19 hospitalizations in Canada per week, average, higher in 2022 and 2023 than in 2021 and 2020, the quote-unquote pandemic years. Even though all of us were still in a pandemic, we have COVID-19 hospital bed capacity, ICU admissions, highest in 2022, reported COVID deaths. So we have all this information here that you guys can search through. All of this is on the Canadian website. And then we'll look at what Michael Holger has to say. I think I'm saying his name right. I might not be saying it right, but we'll look through his tweet for the updated January 29th feed, and then we'll discuss the good news and the bad news. So we'll read the post Peak Hill. Reviewing the graph of the whole pandemic, you'll notice that after about half the waves, instead of a straightforward decline, there's occasionally a temporary deceleration or even a small hill. Currently, this is what the forecasting is showing. It's unclear whether we will see a very small hill, a rebound, a couple of weeks with a flat plateau, or just descend at a gradual pace. But it looks like there will continue to be more transmission on the back end of the mountain than the start, as long as they've continued to forecast for a long time. Okay, so we'll get into good news and bad news now. So, for the good news is that the models that he is using suggest that around Valentine's Day, which is February 14th, so about 2 to 3 weeks away, transmission should start falling rapidly after that point as we approach early spring into March. And that will drop below 1 million daily infections across the entire country of the United States. And then we can start thinking of whether the surge of the 8th COVID wave has ended around that point. And like I said, we don't have another variant right now that we've discovered, at least, that will probably come around and lead into the next surge or be a problem. Because at least for BA 2.6, we saw that in the summer, and that will be the winter wave, which we're seeing now. We haven't seen any new variants that we've detected in recent times, so that will probably mean that the spring overall will have a lower case count than previous years, since there's not going to be an additional variant to help boost numbers back up. The bad news, though, is that the apparent end will still have a long ways down to go. For example, that the starting point of the blue line, the left of the graph, is still the peak of the late summer wave, EG5 wave, which was bad, and that's what has had least for the reported deaths, 1,000 reported deaths weekly of COVID-19 in the United States. That's not including deaths that aren't counted or people who haven't been tested for it in the hospital. So that started the trend. And now, even as we get into February and start entering March, we're still higher than the summer peak. And we'll still probably be higher than it for a decent amount of March. And we have to see where we are in April and May, because that will probably be around where the ceiling's going to be. Not the ceiling, the floor is going to be. We have to see how low the floor is going to be before it can judge, like, okay, the floor is here, so we do get another variant or cases start increasing again when summer hits, or we get something coming along that increases the variance that we haven't seen yet. Then we know from a baseline that, okay, this is the lowest we were going to go, and then it's going to be higher from here. And we'll judge to see, is this baseline higher than where it was last year and the year before, kind of thing. So we'll keep an eye on this. But that's basically all the update that I was wanting to talk to you guys about. So that's the 1.2 million infections a day, long COVID cases as well. So now I will get into what we can do about it, what you guys can do about it. So I have a website called Project N95. They give masks and respirators that are high quality to people. You can get on this website and order stuff here. You can get KN95s, you can get N95s, KF94s, you can get 3M Auras. You can get all the masks that you need from this website. There are also plenty of mask donating organizations across the United States that I will try and find on Twitter, and then for another video I'll try to get them in the description so you guys can go there as well. And then we have AirNets for checking out the CO2 concentrations inside indoor spaces. So that will allow you to tell how much indoor air you're rebreathing in from someone else. And plus it will help you gauge how filtrated the air is. So if the indoor CO2 levels are high, then that means that the amount of air that's being exchanged with the outside the building and with the inside is very low, so the air will be stuffy. And we also do know that high CO2 concentrations make it harder to learn, make it hard to concentrate, and are not very good for academics. So this could help you a lot. You can check them out on this website. I think they're pretty small. You can use it connected to your phone and transmit data that way. And then you carry it around, and then you can look where the higher risk spots for you, when do levels of CO2 start rising quickly, when are the most dangerous spots, stuff like that. It's very important. And then that will be about it. The only other things I recommend you guys do as just like a precaution for yourself is I'll give you like 5 things. You want to try and stay outside of buildings as much as possible. If you're going to eat, you should probably be eating outside or in your own home, preferably in your own home, and try to learn how to make your own food by cooking. For example, I'd also say if you can get wipes to sanitize what you touch, like desks, computers, devices that you may use that you share, or door handles, stuff like that. Trying to get sanitizing wipes. Stuff like Lysol could work well. Carry those around with you, and then wipe stuff down that you will probably be using for either yourself, and especially if other people are going to be using them. I would wipe it down, even like a book or something that you may pick up. It's always a good practice to wipe it down, and also wash your hands. That's something that you should be doing anyway. When you get out the bathroom or eat food or you touch anything dirty, or just shake another person's hand for that matter. Anything you do that involves touching someone else or touching something that someone else has already touched, should probably be washing your hands for 20 seconds. Warm water as always, and then make sure you get every single part of your hands, the crevices in between, your nails if possible, the palms of your hand, the wrist, the back, everything. Make sure you get that. Other than that, you also want to make sure you're wearing a mask at all times indoors. You don't take it off. You don't take it off for any reason unless you have to do something medical where you might have to take an inhaler because your asthma's acting up, or you're out a checkup at a doctor's appointment where you need to get something in your mouth examined, or you need to do a medical procedure. Something like that is the acceptable time to take a mask off. Not when you're doing pictures or any other thing. You don't want to eat inside anyway to reduce that method, because taking off your mask is like taking off your coat when it's cold outside. When you take it off, once, you basically removed all the protection that you had in the first place, so it makes it useless. That's why masking while also eating inside is a useless practice. It invalidates what you were doing entirely. And plus, if you can just make it through the day with a mask on and just eat outside or eat at home, you won't be sick. You won't be spreading those diseases to other people. You'll be able to live a bit longer since you're not going to be aging faster. You want to be doing these things subconsciously just so you're healthy, the people around you are healthy, you're not spreading stuff to other people, making them lose time, not be able to work, not be able to do the things they want to do, hurting them. You might even accidentally lead to one of them getting disabled if you spread the wrong disease to them, COVID-19, or die. So you have to make sure that you are conscious about stuff. And I guess the last thing, which I'll mention, is you just don't try and do anything that's unnecessary. Go places unnecessarily. If you don't need to go somewhere, don't do it. Even if it's a fun thing and you want to go somewhere, you take all the precautions necessary. But if you don't need to go somewhere, I'd really suggest just don't do it and focus on something else. You don't always need to go to a concert or eat in a coffee shop or get something that you want from a certain store. Get something that you need from a certain store that's packed full of people. You don't always need to do that. You can wait. You can either not do it or wait until times where it's better to do it. You can go into the store earlier and get the products faster when you first get into the store. Stuff like that. Be faster. Go to the grocery store earlier in the day instead of later. Stuff like that. That way it's all out the way. Or get it delivered to you. That way you have safety for yourself. You get all the things you need, and you're pretty comfortable. You don't have to waste money on gas, transportation that you could be using elsewhere to pay for bills, for example. And that's about it, guys. So hope you guys enjoyed this update. I hope the comments are better than last time. And yeah, this video was not as long, but I was able to get through a lot more. So hope you guys enjoy it. See you guys next time. Just as a reminder, I have basically all these sources on my actual website that I made, so I'll also leave that in the description. And here are plenty of people on Twitter to follow for information about COVID specifically, or other things that you may be interested in, like variant processing, looking at variants in wastewater, effects of COVID on the body, transmission levels, and all stuff like that. And then how people are responding to it. And then aid organizations, if you can find them through here. All these people do phenomenal work, so hope you guys go check them out. And yeah, I'll see you guys tomorrow I'll see you guys probably not tomorrow, but on the weekend with another video or another stream. And so I know you guys like those. So yeah, I'll also try to add more weather stuff to this, because I also want to make sure that I have all my weather data here as well, so you guys are also informed that way. But yeah, hope you guys have a good day. Stay safe, don't get sick, be happy, and spread the word. Hope this helped you guys out. See ya.